I'd like to spend the next 20 or so minutes talking a little bit about improving care for people with thyroid eye disease, and in particular prediction, prevention and making an early diagnosis. There'll be plenty of time at the end for questions, so do store up some for me. I'm going to start off by just giving a very brief introduction to Graves' disease and then also to thyroid eye disease, and then talk a little bit about the initiatives in the UK currently ongoing to try and improve care for people with thyroid eye disease. I'll then talk a little bit about risk factors, preventing thyroid eye disease and improving early diagnosis, in particular a couple of studies that are ongoing in the North East and across the country at the moment. And then at the end, after a brief summary, there'll be time for questions. So Graves' disease is an autoimmune condition, and this is where the immune system, which has evolved to fight infections, actually turns on the body and starts to attack different organs. In Graves' disease, the immune system produces autoantibodies, and these antibodies are to the TSH receptor. They attach to the receptor and they drive production of thyroid hormones, and this results in thyrotoxicosis or hyperthyroidism or thyroid hormone excess. In the UK, Graves' disease is the commonest cause of an overactive thyroid, and it occurs in approximately 1 to 2% of people over their lifetimes, and it's particularly common in women, affecting 7 times more women than men. Graves' disease is what we call a complex disease. This means that there's not one single cause, but there's multiple factors that contribute. This includes somebody's genetics, the environment that they live in or the things that they do in their lives, and some personal factors as well. Thyroid eye disease is an inflammatory condition which affects the tissues in and around the eye socket, and it's exclusively seen in people with Graves' disease. Most commonly, we see it in people who also have an overactive thyroid, but we can also see it in people who have an underactive thyroid, which we call hypothyroidism, and in people who have normal thyroid function tests very rarely. There's a lot of interest in what links the thyroid gland and the eye, and why people who get Graves' disease may also suffer from symptoms in their eyes. And this most likely relates to the TSH receptor, which is expressed widely in the thyroid, but also in the eye tissues. Thyroid eye disease is classified as either mild, moderate, or severe and sight-threatening, and Professor Pearce will be talking a little bit about this classification later on. The most common symptoms that people report are dry, gritty eyes, watery eyes, and sore eyes, which we call surface symptoms. They may also complain of double vision, which is commonly called diplopia, and also sometimes deteriorating vision, where they're having difficulty, for example, reading small text, which we call reduced visual acuity. The common signs, which are things that doctors might see in clinic or that patients might notice in their appearance, would be swelling and redness around the eyes, which we call periorbital erythema, which is redness, and edema, and then staring of the eyes, which results from pulling back of the upper eyelids or upper eyelid retraction, and sometimes bulging eyes or proptosis. Commonly, the signs will affect both eyes, but one eye may be more severely affected than the other. Thyroid eye disease causes symptoms or signs in 1 in 5 people with Graves' disease. However, severe and sight-threatening thyroid eye disease is actually quite rare. However, even if in its mildest form, thyroid eye disease can actually be very distressing, and this is because it can result in discomfort and pain, and it can significantly reduce someone's quality of life, even if it's medically classified as mild. It can result in difficulties in working and driving, in particular if someone suffers from bad double vision, and it can also result in disfiguring changes in appearance, and this can be quite depressing and have significant psychological impact upon patients. Finally, in the most severe circumstances, it can result in significant loss of vision and ultimately blindness. Unfortunately, not all people with thyroid eye disease get the best possible care, and this relates to a combination of factors, including a delay in diagnosis, in people not receiving perhaps the simple effective treatments early on that can be of great help, and also delays in referral to specialist care. In 2009, a group of people met in Amsterdam to try and address these problems with care in thyroid eye disease, and they came up with a set of proposals called the Amsterdam Declaration. The people who met were a combination of experts in thyroid eye disease, professionals with an interest in thyroid eye disease, and patient representatives. Ultimately, they agreed that there are a number of needs within thyroid eye disease and prioritised these, including raising awareness, particularly amongst healthcare professionals and managers, not just those with a particular interest in thyroid eye disease, but also general practitioners and people who come into contact with patients with thyroid eye disease all of the time. They decided there was a real need to establish some pathways for referral and for care of patients with thyroid eye disease, and to support existing centres of excellence. In addition, they felt that new centres of excellence were needed in places where these were lacking. The ultimate aim is to halve the time from presentation of thyroid eye disease symptoms and signs to diagnosis, and to halve the time from diagnosis to referral to a centre of excellence. The Amsterdam Declaration also outlined ways of promoting prevention of thyroid eye disease, and also in improving research networks and getting more collaborative research going. Later on in that year, 2009, the UK Thyroid Eye Disease Amsterdam Declaration Implementation Group, or TMED, was established to try and implement the Amsterdam Declaration in the UK. TMED's made up of representatives from endocrinology, from ophthalmology, and from patients with an interest in thyroid eye disease, with representatives from both Thyroid Eye Disease Charitable Trust and also from the British Thyroid Foundation. TMED has a lot of work going on, but there are 3 particular themes, and these include raising awareness. So a couple of years ago, we had a 2-day thyroid eye disease conference for both patients and professionals in Newcastle, which was a great success. TMED have written some thyroid eye disease guidelines, which have been published in the Clinical Medicine Journal, which is the journal of the Royal College of Physicians. And we've also been implementing an early warning card system, which I'll come back to. In addition, members of TMED have been talking to NHS managers and commissioners about commissioning specialist services for TED, particularly as the funding climate in the NHS is changing. We've also been doing some work to gather information about thyroid eye disease care in the UK, including patients' experiences of thyroid eye disease, which we've collected information through a survey, and of surveys of specialist centres and the sorts of treatments that they're offering and the people that they're seeing. Finally, there's a stream to try and improve prevention and early detection of thyroid eye disease, and this includes development of a web-based smoking tool, management after radioiodine, and screening of all patients with Graves' disease for thyroid eye disease. So, who is at risk of thyroid eye disease? Well, I suppose anyone with Graves' disease is at risk, but there are some specific risk factors. These are divided into those that are fixed and those that are modifiable. So the fixed risk factors that you can't really do very much about are your genetics, which you inherit, your gender, so if you're a man, you're more likely to develop thyroid eye disease than a woman, and as you get older, your risk increases. However, there are some risk factors that are modifiable. We can do something about these, and these include smoking, radioactive iodine exposure, and fluctuations in thyroid function, in particular hypothyroidism. I'll come back to a couple of those. Overall, it is quite difficult to predict who will develop thyroid eye disease. Therefore, all patients with Graves' disease should be warned about this possibility so that they're alert to any signs and symptoms. Smoking, as we know, is bad for everybody. I'm a smoking or an anti-smoking evangelist. It's linked with cancer and heart disease, but it's particularly bad for people with Graves' disease and thyroid eye disease. And this is because smoking contains thousands of chemicals and toxins, and these can stimulate the immune system as well as doing all sorts of other harm. Unfortunately, smoking reduces the amount of oxygen in tissues, which we call hypoxia, and low oxygen levels are associated with inflammation, particularly in the back of the eye. Smokers are at least 2 times more likely to develop thyroid eye disease than non-smokers, and if you smoke heavily, your risk is increased up to 8 times more than non-smokers. However, if you do manage to quit, the good news is that the risk of thyroid eye disease does drop. In addition, smoking makes you more resistant to common treatments for thyroid eye disease, like steroids, and also if you require surgery for your thyroid eye disease, it makes the healing more difficult. Therefore, all patients with Graves' disease and with thyroid eye disease should be advised to try and quit smoking if they possibly can, although we do appreciate that's easier said than done. And they should be offered support to try and quit smoking, for example with nicotine replacement or one-to-one support, which can be very effective. Radioactive iodine is a really safe and effective treatment for thyroid overactivity, but it can aggravate thyroid eye disease that's already existing. And thyroid eye disease can start newly after radioactive iodine treatment. And this is a particular risk if you're a current smoker or if your thyroid function is not well controlled after you have your treatment. To prevent thyroid eye disease in people who've had radioactive iodine, we suggest that radioactive iodine should be avoided in people with active thyroid eye disease. And often, if we have a patient who's had thyroid eye disease and they're considering radioactive iodine, we refer them on to ophthalmology for review, just to double check their eyes and make sure that their thyroid eye disease is currently inactive. We encourage smokers to try and quit before they have radioactive iodine treatment, and we try to control thyroid function carefully after radioactive iodine treatment. Finally, for those people deemed to be at particular risk, occasionally we do give courses of steroids after radioiodine to reduce the risk of thyroid eye disease occurrence. So moving on to early diagnosis. As I've said before, early detection and early diagnosis of thyroid eye disease is a priority in the Amsterdam Declaration. We think that early detection is worthwhile because there are some really effective and very simple treatments that exist for early active thyroid eye disease, including selenium, topical treatments like lubricating eye drops and ointments, and also smoking cessation. And I think Professor Pearce will talk further about that. The TMED group in the UK have introduced 2 initiatives to promote the early detection and diagnosis of thyroid eye disease, and I'll talk about these 2 projects separately. Diago is a thyroid eye disease screening tool, and we felt that this was necessary because most people who develop thyroid eye disease will actually be seeing an endocrinologist in clinic for their Graves' disease. However, the diagnosis is often still delayed. And therefore, we felt that a thyroid eye disease screening tool would be useful for the use of all people with Graves' disease to help make an earlier diagnosis. With this in mind, the TMED group devised a 20-point assessment tool, which we call Diago because it stands for Diagnosis of Graves' Orbitopathy. The screening tool is divided into 2 parts. The first part is 13 questions that the patient can answer themselves about their symptoms of thyroid eye disease if they have any. And example questions include, do you have redness of the eyelids? Are your eyes excessively gritty? And are your eyes abnormally sensitive to light? The second part comprises 6 questions which the assessing doctor answers about the appearance of the patient's eyes and whether the patient appears to have any eye abnormalities. Example questions include whether the eyes look abnormal, whether there's any eyelid retraction, and whether the eyes move normally. We first tested this screening tool back in 2012 and 2013 in a pilot study between Newcastle and Exeter. We tested it on 104 patients with Graves' disease. We included 27 positive controls with thyroid eye disease, and we included these people because we wanted to see whether the screening tool was sensitive at picking up the signs and symptoms of thyroid eye disease. We also tested it on 77 people with Graves' disease, not known to have thyroid eye disease, to see if any of these people might have early signs. In total, all 27 of the controls scored positively using the assessment tool, showing that this is a sensitive way of detecting thyroid eye disease. Of the 77 people with Graves' disease who used the assessment tool, we found that 27, or 35%, reported either signs or symptoms within the tool, and these people were all referred on to the ophthalmology clinic for further assessment to see whether they had thyroid eye disease or not. Of those 27 people, most had a combination of both signs and symptoms, so something to see as well as something to feel. 6 out of 27 had symptoms only, but their eyes looked normal, and 2 out of 27 were referred to ophthalmology because their eyes looked abnormal, although they had nothing to complain of in terms of symptoms. So those 27 people were all referred on to the ophthalmology clinic, and 26 turned up for a review. And of those, 24, so 92%, were confirmed to have thyroid eye disease. And half of those patients were offered a specific treatment after their ophthalmology review to treat their thyroid eye disease. The 2 people who did not have thyroid eye disease turned out to have glaucoma and prolapsed fat pads. So the glaucoma patient was referred on to the specialist glaucoma clinic, and the individual with prolapsed fat pads was offered further treatment but declined and was reassured by their assessment. In order to evaluate this further, we're now doing a larger multi-centre study, and this is across the UK, currently in Newcastle, Exeter, Leeds and Cardiff, with other centres possibly opening, to use this tool on a larger group of patients to make sure that it's effective and to validate it. And ultimately, our aim is for all patients with Graves' disease to be screened for signs and symptoms of thyroid eye disease in order to pick this up early, improve detection rates, and offer people earlier treatments which can be very effective. The second small project I wanted to talk about was the Thyroid Eye Disease Early Warning Card project, which TMED have been carrying out. And we wanted to do this because we don't feel that patients with Graves' disease are always warned about the possibility of thyroid eye disease. And so when they do develop signs in their eyes or symptoms, they don't always link this to their thyroid problem. And there are plenty of examples of people who've been to see medical doctors with eye symptoms and have gone away with multiple treatments for conjunctivitis, which are clearly not going to be effective in thyroid eye disease. So the TMED group devised an early warning card to give to patients with Graves' disease to see if these would encourage people to report any eye symptoms. So you can see here that this is a sort of four-part card which folds in two. So here, I don't know if you can see that, here's the front part of the card and this is the back with information about where to get more information. And then here are the common symptoms of thyroid eye disease, and here the centre that's giving out the cards will put a contact name and contact telephone number or email so that people can get in touch if they develop any signs or symptoms. So we tested this out between December 2015 and March 2016 in a small study between Newcastle, Exeter, Cardiff and Edinburgh. We handed out cards over a period of about 3 months, and then we followed people up for 9 months to see who phoned in and what they phoned in about. 3 months into the study, we asked patients for feedback to find out how they felt about receiving a card and whether it had been useful. And at the end of the study, we reviewed everyone's clinic letters to see if anyone had developed thyroid eye disease but had not reported it through the local contacts. In total, we handed out 160 cards, and we handed these out to people who were newly diagnosed with Graves' disease and also with people, for people who were follow-up patients who'd had Graves for a while. Over the course of the follow-up period, 9 months, 9 people called the helpline number. So 1 person called twice, so there were 10 phone calls in total. All of the phone calls were entirely appropriate and related to eye symptoms. And of those, 1 patient was referred to their GP because they had symptoms of a possible transient ischemic attack or mini stroke. But the other 8 patients were seen in clinic. And 4 out of the 8 had thyroid eye disease and were offered treatment for this. We tried to collect some feedback from patients about the study. We sent all 160 card recipients a request for online or postal survey, and 49 responded. So that's 31%, so a slightly disappointing response rate. However, of the 49 who had received a card, 45 remembered having received one. And of those who had received a card and remembered, 40 out of 45 felt that the card was useful. And most of them actually understood what the purpose of the card was. 8 out of 45 people had reported that they had some eye problem during the time, but only 3 of those had actually called the helpline. Of the 3 people who called the helpline who'd responded to the survey, the feelings about the helpline were quite mixed. 1 person had said it had been really helpful, 1 person had said it had been somewhat helpful, and 1 person had said that it had been unhelpful. And this is because they'd phoned a couple of times and hadn't actually managed to speak to anybody, and so were not very satisfied, understandably. In total, at 9 months, 5 out of 160 people who'd received a card had developed thyroid eye disease but had not reported it through the helpline, so hadn't phoned up. So we found using this study that thyroid eye disease cards are generally used appropriately. People were ringing up about eye signs and symptoms, and they allowed 4 people to receive an earlier diagnosis of thyroid eye disease. Generally, the feedback was that these were well received. However, if we were to roll this out nationally and encourage everyone to give thyroid eye disease warning cards to patients with Graves, we'd have to think really carefully about the logistics of providing a helpline in order to meet patient expectations. The 5 people who'd received a card who developed thyroid eye disease but did not use the helpline, we're not quite sure why this is, but perhaps those people may not have had any symptoms and perhaps their thyroid eye disease was picked up on examination in clinic. Perhaps they developed mild symptoms just before a follow-up appointment and therefore hadn't felt the need to call the helpline because they had a follow-up appointment coming up. Or perhaps they'd forgotten about their card, which makes you wonder about the durability of the intervention. We think that giving thyroid eye disease early warning cards would be helpful for all Graves patients, even if this is just to raise awareness of the possibility of thyroid eye disease within this patient group, and also to encourage people to report their symptoms should they develop. It is difficult to predict who's going to get thyroid eye disease, so it's definitely worth warning people about it in advance. This is because diagnosis is often delayed. Prevention is better than cure, so it's really important that we encourage people to try and quit smoking if they can, and that we use radioactive iodine carefully and follow up carefully afterwards. Simple and effective treatments are available. These should be used early on. And patients should be warned about thyroid eye disease and encouraged to report symptoms early on. We think that all Graves patients should be screened for thyroid eye disease, and that should be at every follow-up really. But the good news is there's lots of work going on in this area at the moment in the UK, so there will hopefully be some improvements to the care of thyroid eye disease patients. Thank you very much.